Good morning and welcome to Focus Today. Steve Johnson with you and Dr. Joel Klein. Good to have you back. It's been a little while since you've been here, but great to have you back from Ventana Wellness. Right there in the heart of Medford. And we're going to be talking about a subject that you could have been diagnosed with this. You might have just heard a lot about it, but I think there are a lot of misconceptions, and we're going to talk about gluten and celiac disease and all of those things that are kind of related to that. Let me just ask you, are you seeing a rise in patients who seem to have this particular problem? And I want to talk about the problem more in depth, but are you seeing an increase?
Oh, very clearly.
Okay, yes. Let's get down to the basics. When we talk about gluten and problems that people have with gluten, what is gluten to begin with? Because it's in a lot of our foods, isn't it?
It's a protein. It's in a lot of places, but the most common place is in a lot of the larger cereal grains. So wheat is the most common source. A lot of the other cereal grains that can have it are barley, rye, even the health food store grains like spelt, that's a cousin of wheat, also have gluten. So it's a protein that's actually in the grain itself.
So we're finding it in bread, in spaghetti,
anything made with flour, because we pay a lot to grow a lot of wheat that goes all over the world, and they have to do something with all the surplus. And
this isn't something that's added in. This is just something that is a part of that whole wheat aspect, right?
For the most part. Occasionally it's added in. I still haven't figured out why it's in soy sauce, unless you get gluten-free tamari, but somehow there's gluten in there, and it's added into some other foods.
Yeah, because I was thinking like MSG. They'll say MSG free if you don't like the flavor of that and whatever, and it's like, why did they add it in? Because you can add MSG in, but this is different.
Right, that's different.
Right? Yeah. But so soy sauce has gluten in it.
Well, unless it says gluten-free. Okay. I know.
All right. And now, related to gluten is celiac disease that people have been diagnosed with. What actually is that? Because 10 years ago, I don't know if anyone had really heard of it.
Well, this is the biggest issue. So it was first figured, it was seen frequently. Children were dying of this on a regular basis, particularly in Europe. And a pediatrician, either from Belgium or the Netherlands, I never remember which, figured out after World War II, because they didn't see any kids dying of celiac disease during the war. And then all of a sudden the war was over, and they started seeing kids dying of celiac. Because celiac is based on a Greek term meaning in the intestines. So they didn't know what caused it.
Okay.
He figured out because the bread was rationed, and that it was wheat that was doing it. Now, it was thought that this occurred in 1 in 3 to 5,000 people, which is why you didn't hear a lot about it. But researchers at my medical school actually published an article in Scientific American in 2009 where they tested 13,000 healthy people for the blood test. And we'll talk about that's actually probably only the tip of the iceberg of the people who suffer from symptoms, or people who have a positive blood test. And even that they found in 1 in 133 healthy people, not 1 in 3 to 5,000.
So was that doctor right, that because bread was rationed in World War II, that's probably why they didn't have the problem that they had after?
Exactly, yes.
So because
he figured out because the bread was rationed, people weren't eating it that much, and they didn't see any problems until the restrictions were lifted. And then around 1947 or so, he kind of put the picture together and realized that it was the bread that was doing this.
Did they at that point then start taking people off of bread who seem to have celiac disease?
Yes.
I mean, was there an effort to do that?
Right. They figured out. He figured out it was wheat, and again, it was a small percentage of people, but clearly, and children in particular that had these gastrointestinal symptoms that they couldn't explain, but they were violently ill, I should say, or certainly they were very ill. They would get even bloody diarrhea. I mean, these were sick people, and that was one of the first things they figured out. All right, let's get that out of there.
And they knew that it was somehow related to that whole sequence. Boy, I'll tell you, without the rationing, they may not have figured that out for a while.
Well, it would have taken a longer period of time, right?
All right, you said that in your own practice you're seeing more people who have this particular problem. Why are we seeing more people diagnosed with this?
Well, this is the $64,000 question. One of the things is there's a spectrum. The people with true celiac disease, number one, you can get they actually have genetic predisposition. So there are genes that can actually be looked for on blood tests now. They are usually more sicker people that any gluten really makes them ill. What we're seeing is a large spectrum of people who now may not test positive for either the antibody in their blood or not have the gene, yet they still clearly feel a lot better when they don't eat gluten. So we're calling those people gluten intolerant. And my suspicion is it is a perfect storm of what's happened to the health of our gastrointestinal tracts over the past 50 years with high processed food diets, exposure to antibiotics, that are disturbing the intestinal environment in a way to make it more reactive to foods. And it may also relate to the monocultures of wheat, even beyond the GMO issue, that are now being used in agriculture may actually be these subspecies that they haven't looked at it as much, seem to be more prone to producing this problem, because people who can eat bread in Europe will come to the United States and say, I can eat it in Europe, but I can't eat your stuff.
Oh, really?
So yeah, so there's still it still has to be worked out, but there seems to be multiple factors involved.
You know, and I remember just seeing a recent article about one of the doctors saying that he thinks that we are becoming an intolerant society to antibiotics. We've given so much out now that we have nowhere to go, and the different strains have adapted to it and all the rest. So this sounds like this would be tied in. With
indirectly. It's a more complicated story, but what I find is that the patterns of imbalance in the gut related to giving people antibiotics so that the normal healthy environment of good bacteria, which we're now, even the gastroenterologists are coming around to realizing that probiotics, healthy bacteria supplements, are beneficial for people. They've been doing this in India for 5,000 years by making yogurt fresh every night and eating it the next day. But it seems that this disturbed environment in the gut, in my clinical experience, is much more prone to producing food allergies, with gluten being number one on the list. Dairy, corn, and soy are also not uncommon.
You know, and it makes me wonder, you mentioned yogurt. I've seen some that talk about having active cultures in it and all the rest, and that may be a part of this.
Part of it. Well, you can't make yogurt without active cultures. So that's kind of, if you're really making yogurt. So that's a marketing ploy. The thing is that by the time you get it, the bacterial count is much lower. It can be beneficial for people. Now they're using, of course, these special strains of bacteria that they're putting in some of these special yogurts that they're advertising that way. But you don't get nearly the benefit of making your own, but making your own is a lot more of a pain.
All right, let's talk a little bit about people who may think they are gluten intolerant and the testing for all of that. Is this pretty involved?
No, because part of it is, number one, even half of people with diagnosable celiac disease have no stomach symptoms.
Oh, really?
But they have
what are their symptoms?
They have inflammatory problems. They may have arthritis. They may be asthma. Can be all, I would say, somebody who has a whole list of symptoms and the doctors can't find anything wrong. A lot of times it's going to be a food allergy reaction. You can get the testing. My experience is that for every positive blood tester, I will find multiple people whose blood tests are negative for celiac disease and they still feel better when they stop it. So the simple test is to not eat it 3-4 weeks. And most people will notice an improvement in whatever the symptoms are. And then particularly after being off it for a few weeks, if they reintroduce it back, the feedback is usually pretty dramatic. Like that evening, the next day, they will feel poorly. They'll feel achy all over, or headaches, or stomach symptoms, or any number of different problems.
And when you say not go on it, you're talking about the food that has gluten in it, right?
Right.
Now, but that's hard, isn't that, here in the United States? I mean,
if you buy things that the food companies make, yes. If you buy the things that God made, no. So there's
naturally and all.
Yeah, there's no gluten in vegetables.
Okay.
These are all in flour products, and again, it's even easier now. You can get gluten-free anywhere. Obviously, even the regular stores, or certainly the health food stores and these kind of places, all have gluten-free products.
And I've wondered about that, because I've seen a gluten-free raisin toast, or raisin bread, which I like raisin bread. And I'm wondering, is it really though? I mean, is there much oversight to all of this?
They're supposedly not able to say gluten-free unless it truly is gluten-free. Really, so these things are going to be things made with rice flour. And other things, because rice does not have gluten, so a lot of times it will be made with that.
Oh, that's interesting. So rice doesn't, but potatoes would, and so you have to.
No,
potatoes don't.
No real vegetables have gluten like that.
So mostly bread, wheat.
Yeah. I mean, I think some of the heavier beans, I have to go research that. Maybe sometimes, but they're more starchy. But no, it's the grains. Okay. Rice does not. Oats don't naturally have gluten, but they get contaminated where they're processed. So if you can now get gluten-free oats, or it turns out the steel-cut Irish style with people cut also are processed in different facilities, so they also don't have gluten.
This is one of those things almost where you need to have a checklist, I think, to go in and make sure that you don't have it, because as you said, you may think it doesn't have it, but the store that it or the manufacturing plant it was in could have contaminated it from that standpoint. When people find that they are sensitive, is it something that comes on slowly, or is it like immediate from your experience?
Oh, it can be very insidious. Now, for some people, again, I think with the people who have the genetic predisposition, they've had problems with digestive issues all their life and nobody's been able to figure it out. So it's been labeled as irritable bowel or some other type of problem. So that's more insidious. I think it's not common. I've had people who had, after heavy courses of antibiotics for a severe infection, all of a sudden became sensitive. More commonly, it's kind of insidious and kind of sneaks up on people over time.
So somebody could be fine all their life, and as they get older, they become sensitive towards gluten?
That's my experience. Those are going to be the people who are more like gluten intolerant. They don't have the genetic predisposition, but because of issues through life, have slowly developed conditions in their GI tract where they're now sensitive to it.
So do you find you have a lot of older patients who are coming in, or are they younger?
Oh, no, mostly older.
They are, okay. Because if they're younger, it's probably genetic. Would that be accurate?
Can be, although the way we treat our children now, many of our children have been exposed to huge doses of antibiotics starting in early childhood. So they've had digestive problems like since the age of 5, and it could have even started back then, and still not necessarily be a genetic issue.
Okay. All right, we're going to be talking about how do you test for gluten intolerance anyway? How do you go about doing that? Our guest is Dr. Joel Klein with Ventana Wellness, and we'll be back with more of our discussion about all things gluten and celiac disease right here on Focus Today. Welcome back to Focus Today. Steve Johnson here with you, and Dr. Joel Klein from Ventana Wellness, and we're talking about celiac disease and gluten intolerance and what it's all about anyway. Because if you're like me, you've had a whole lot of questions about just what is this whole thing gluten? Didn't hear about it when I was a kid, hearing a lot about it now, and as you said, doctor, you're seeing more patients coming in that you're identifying as having some sort of a gluten kind of a problem. Right. Let me ask you that once you have found out that they may have this problem, you have to do some testing. How involved is this?
Not very. It all depends on if they have mild symptoms. I sometimes won't do the testing. The only testing you can do is for for antibodies or for the genes that predispose people. And I would say that can be important, but that is, in my experience, actually the minority of patients who actually have the real genetic issue. There's a much larger degree of people who have a sensitivity that the only way you really find out, like I said, is to do an elimination diet. You stop it for a period of time, see how your body does, then reintroduce it and see if you have a reaction. Is really the only definitive test for it, because there may be all kinds of other things that are going on in there appear to be that we just don't have tests for at this point.
So it's not like a checklist necessarily until you actually use the person as the example.
You do the person as an experiment of themselves.
Yeah, and again, it's focusing on wheat. On grains, you said, right?
Predominantly,
that's
right.
Where that is. So you eliminate them completely and then slowly reintroduce. Is that the idea?
Yes, but it depends on the problem. I won't have them necessarily eliminate all grains, just the ones that contain gluten.
Now, we were talking about an aspect of related problems to that. I mean, it sounds to me like a person could be diagnosed with other problems that are really gluten and celiac related.
Right.
But they're kind of misdiagnosed because there's a whole range of physical problems, maladies they can have, right?
All these different inflammatory problems. People can actually not have stomach problems. As I said, even half of people with diagnosable celiac disease don't have gastrointestinal symptoms.
So what might they have?
I will see people down the list: asthma, eczema, migraines, arthritis, any autoimmune disease may be related to gluten. In fact, that was the gist of the article in Scientific American, was the actual mechanism of how gluten would be causing this inflammation that's associated with autoimmune and inflammatory problems. Women with hormonal or menstrual issues, particularly going back, and even if they're teenagers, with bad cramps or cysts or these types of things, a lot of times gluten can be related. Even endometriosis, gluten or these food allergies can be playing some part in.
I can see where somebody who has an asthma or arthritis problem, they wouldn't even think of celiac disease. I mean, again, it's not related to their stomach, but so they could be, I suppose, diagnosed with, for years, being treated for all sorts of other things.
They can see the rheumatologist for the joint problems. They can see the pulmonologist or allergist for their asthma. They may be seeing the dermatologist for their eczema, and all of these different things all actually related to the same thing.
Once a person finds that they are sensitive to gluten, is there a cure for them, or do they have to live with this?
There's not really a cure. Now, again, the people with true celiac, usually they just have to be careful the rest of their lives. But there's a spectrum to it, and that some of these people who are gluten intolerant because of, let's say, antibiotic histories and other things, a lot of times we can help use naturopathic type of remedies to rehabilitate their gastrointestinal tract so that over time they are able to eat it, but never in the amount that they were before. They'll find out maybe, okay, I can do this much and I'm okay, but if I do this much, not, or I can do it once or twice a week, but any more than that, and I get symptoms. So they're never typically able to eat it with impunity without suffering some sort of consequences, but they find they can get away with little bits once in a while. And quite frankly, a lot of the times, once they've gotten to that point, they don't really want it anyway because they feel so much better. Their body has stopped craving it.
I know you're a person who doesn't necessarily want to put a person on drugs, you know, as a first recourse. You want to find out these things. Right. Are there drugs, though, that can also help them that they have to keep taking?
No. The drugs, well, there are drugs that can help suppress symptoms. So if they have irritable bowel or these other types of things, but that's all they're doing is treating symptoms. There are no drugs that will actually treat the condition.
Okay. Are there a lot of people that you know that are on those kinds of drugs?
Sure. Oh, yeah, people being diagnosed with irritable bowel syndrome for any number of different things and giving all these different medicines, or being put on acid blockers for indigestion. And all of these things potentially could have a food allergy relationship.
All right, you know, this sounds like if somebody has a problem with gluten and they get off and they feel better, shouldn't we all be doing that? I mean, how do you approach that?
Not necessarily.
Aspect? Okay,
I think somebody who feels fine really probably doesn't have an issue. If you don't really, people who feel healthy, this is not so that gluten is not inherently dangerous. But what it is, it's an extremely common allergen, what we would call it, or trigger for many, many people. People without any health problems really don't need to go looking for stopping gluten just because it might be healthier, because I don't think it's going to be that much of an issue for them.
So you're not making grains out to be bad necessarily for everybody. It's just people who have a sensitivity.
It's just what we've done with them. Yeah.
Well, it makes me wonder, we're not really moving away from processed foods, are we, generally speaking? In fact, we're moving more towards it, aren't we?
Sure.
So you're expecting this to be more of a problem?
Well, yeah, well, yes, and because not so much in the foods related. I think we've probably gotten to where we're going to get to with regards to the foods. I can't know that they would do much more with the foods than they've already done. But as people's gastrointestinal tracts become more and more damaged by modern life, then we're going to be, seeing even more and more, of these very potentially.
Do organic foods play a role in this at all, or is that a different issue?
That would be a different issue, because, the organic issue would have to do, obviously, with things like pesticides and the like, but also with the nutrition in the plant. We don't have time to go into it, but the organically grown vegetables will have more of these phytonutrients that are very healthy for us, because all of those plant products that are healthy for us are produced by the plant for defense. And if all the stresses have been taken away from the plant, with pesticides and everything else, the plant doesn't have any need to produce those chemicals. But that's a different issue.
We might have somebody who's watching and listening to this saying, you know what, I think you're talking about something I might have, but where do I actually start to try to pull back on some of the foods that I'm eating that could be causing this problem, and then move towards introducing them to see if, in fact, if I do feel bad. Do you suggest they just stop eating bread, for example?
Well, it all depends.
What do you suggest?
There's two ways to do it. I tell people, if you really want to get the answer as quickly as possible and efficiently as you can, you do it 100% for 3 to 4 weeks. I don't think, it may take a little bit of planning. That's not that difficult. The problem is let's say you only do bread. If you get better, great, but if you don't, then we don't know, well, it's because we're barking up the wrong tree altogether, or it's that you just need to do more, so the process can take months that way.
So you're saying a doctor should be involved in this to...
Not necessarily.
So what do you suggest they do then?
If they want to, go to the website celiac.com. which is for celiac patients. There's more information there than anybody can digest. It'll give them the list of foods, and they plan out for themselves how to shop, and they go, and eliminate gluten from the diet as best they can for, like, say, 3 to 4 weeks.
And it's a credible website you found?
Oh, absolutely. Oh, yeah. This has all the scientific data, all the studies. Yeah, this is the place that I will refer people. Diet suggestions, menu plans, all kinds of things on there for folks.
Americans have this, you say, a bigger problem than it seems like some other countries, like Europe and all that?
Well, it's just that supposedly this was a European disease in the beginning. It's supposed to be Northern European, although the Scientific American researchers said they basically found it now on all continents and all races.
And again, the simple reason for that is more processed foods?
It may not be that simple, but it may be because we've been exporting our wheat all across the world for the past 50 years and whatever strains of wheat that we're using. I think it's, Americans eat more processed foods than people in other countries. I think certainly our whole economy is now developed into one that serves the fast food industry, and with the large agricultural giants, the agricultural subsidies, everything in our culture and economy drives people more into eating those foods more so than I would say they do in other countries.
When you've got a patient, I realize, as you said, this sounds like it's a highly subjective problem. Everybody has to be analyzed differently. Is there any way that you can give an idea of how soon somebody can figure this out if they have the problem? When will in other words, if it is, let's say, bread related, that they've got celiac disease and they stop eating bread, how soon does that take for them to feel better? Is it immediate?
3 to 4 weeks.
3 to 4 weeks, so a month or so.
Now, the deeper inflammatory things, let's say somebody has an autoimmune or an arthritis issue or one of these deeper inflammatory diseases, that can usually take several months, up to 3 months. But in terms of if they're looking at gastrointestinal symptoms, even I've had allergy symptoms, a lot of airborne allergies, even people who've tested positive for mold and pollens and these things, I find are actually downstream effects from the gluten issue, and you take away their gluten, and then a year later they'll come into the office and say, this is the best allergy season I've had in 20 years, and I'm not even treating their allergies. So really, it depends on those.
Do you find the medical community is kind of getting more in tune with the aspect that one of the problems that could be totally unrelated to your stomach, so you think, is actually a part of that? Is there more of an education that's going on, do you think,
they're coming around.
How does that even happen? Because do you talk about these at your National Association meetings, or is this just through sharing information?
Well, you have to have at educational meetings. You need doctors who are looking into this, educating other doctors about the problem. I think the Scientific American article certainly helped in that respect.
Yeah, it makes me want to go back and look at that. Do you remember what edition that was?
August 2009 by Alessio Fasano at the University of Maryland. It's called "Surprises from Celiac Disease." Okay. I have a copy. I have a drawer. And I have that article, copies of that in every patient room that I give to people, and I've mailed them to a couple local specialists too.
Okay, and if you want, celiac.com.
Yes, that would be a very good resource for anybody looking for more information, sometimes maybe more than they wanted to look for. All right. Everything is there.
And that's CELIAC, in case you're wondering how that's actually spelled when you go to the .com website. Dr. Joel, thanks for being with us.
Thank you, Steve. Always a pleasure.
All right, and we'll be back with more Focus today. Keep it tuned right here on the Dove.